RN Prometric Exam Collection 121 to 140. Part 7. 121. A nurse develops a plan of care for a woman with human immunodeficiency virus infection and her newborn. The nurse includes which intervention in the plan of care? 1. Monitoring the newborn's vital signs routinely. 2. Maintaining standard precautions at all times while caring for the newborn. 3. Initiating referral to evaluate for blindness, deafness, learning problems, or behavioral problems. 4. Instructing the breastfeeding mother regarding the treatment of the nipples with Nystatin ointment. The answer is 2. Maintaining standard precautions at all times while caring for the newborn. Rationale: an infant born to a mother infected with human immunodeficiency virus, HIV, must be cared for with strict attention to standard precautions. This prevents the transmission of HIV from the newborn, if infected, to others and prevents transmission of other infectious agents to the possibly immunocompromised newborn. Mothers infected with HIV should not breastfeed. Options 1 and 3 are not associated specifically with the care of a potentially HIV-infected newborn. 122. A nurse is planning care for a newborn of a diabetic mother. A priority nursing diagnosis for this infant is 1. Hyperthermia related to excess fat and glycogen. 2. Risk for injury related to low blood glucose levels. 3. Risk for delayed development related to excessive size. 4. Risk for aspiration related to impaired suck and swallow reflexes. The answer is 2. Risk for injury related to low blood glucose levels. Rationale: the newborn of a diabetic mother is at risk for hypoglycemia, so risk for injury related to low blood glucose levels would be a priority nursing diagnosis. The newborn would also be at risk for hyperbilirubinemia, respiratory distress, hypocalcemia, and congenital anomalies. Hyperthermia, risk for delayed development, and risk for aspiration are not expected problems. 123. The nurse determines that a new mother understands the teaching about prevention of newborn abduction if she states 1. I will place my baby's crib close to the door. 2. Some healthcare personnel won't have name badges. 3. It's okay to allow the nurse assistant to carry my newborn to the nursery. 4. I will ask the nurse to attend to my infant if I am napping and my husband is not here. The answer is 4. I will ask the nurse to attend to my infant if I am napping and my husband is not here. Rationale: precautions to prevent infant abduction include placing a newborn's crib away from the door, transporting a newborn only in the crib and never carrying the newborn, expecting healthcare personnel to wear identification that is easily visible at all times, and asking a nurse to attend to the newborn if the mother is napping and no family member is available to watch the newborn is never left unattended. If the mother states that she will ask the nurse to watch the newborn while she is sleeping, she has understood the teaching. Options 1, 2, and 3 are incorrect and would indicate that the mother needs further teaching. 124. A nurse is caring for a client who is receiving oxytocin, Pitocin, to induce labor. The nurse discontinues the oxytocin infusion if which of the following is noted on assessment of the client? 1. Fatigue. 2. Drowsiness. 3. Uterine hyperstimulation. 4. Early decelerations of the fetal heart rate. The answer is 3. Uterine hyperstimulation. Rationale: oxytocin stimulates uterine contractions and is a common pharmacological method to induce labor. Adverse reactions associated with administration of the medication are hyperstimulation of uterine contractions and non-reassuring fetal heart rate patterns. Oxytocin infusion must be stopped when any signs of uterine hyperstimulation are present. Drowsiness and fatigue may be caused by the labor experience. Early decelerations of the fetal heart rate are a reassuring sign and do not indicate fetal distress. 125. Methylorgonavine, Methergine, is prescribed for a client with postpartum hemorrhage. Before administering the medication, a nurse contacts the healthcare provider who prescribed the medication if which condition is documented in the client's medical history. 1. Hypotension. 2. Hypothyroidism. 3. Diabetes mellitus. 4. Peripheral vascular disease. The answer is 4. Peripheral vascular disease. Rationale: methylergonavine is an ergot alkaloid used to treat postpartum hemorrhage. Ergot alkaloids are contraindicated in clients with significant cardiovascular disease, peripheral vascular disease, hypertension, preeclampsia, or eclampsia. These conditions are worsened by the vasoconstrictive effects of the ergot alkaloids. Options 1, 2, and 3 are not contraindications related to the use of ergot alkaloids. 126. A client in preterm labor, 31 weeks, who is dilated to 4 cm has been started on magnesium sulfate and contractions have stopped. If the client's labor can be inhibited for the next 48 hours, what medication does the nurse anticipate will be prescribed? 1. Betamethasone. 2. Nalbuphine, Nubain. 3. RhoD, immune globulin, RhoGAM. 4. Dinoprostone, Cervidil vaginal insert. The answer is 1. Betamethasone. Rationale: betamethasone, a glucocorticoid, is given to increase the production of surfactant to stimulate fetal lung maturation. It is administered to clients in preterm labor at 28 to 32 weeks of gestation if the labor can be inhibited for 48 hours. Nalbuphine, Nubain, is an opioid analgesic. RhoD, immune globulin, RhoGAM, is given to Rho-negative clients to prevent sensitization. Dinoprostone, Cervidil vaginal insert, is a prostaglandin given to ripen and soften the cervix and to stimulate uterine contractions. 127. Methylergonavine, Methergine, is prescribed for a woman to treat postpartum hemorrhage. Before administration of methylergonavine, the priority nursing assessment is to check the 1. Uterine tone. 2. Blood pressure. 3. Amount of lochia. 4. Deep tendon reflexes. The answer is 2. Blood pressure. Rationale: methylergonavine, an ergot alkaloid, is used to prevent or control postpartum hemorrhage by contracting the uterus. Methylergonavine causes continuous uterine contractions and may elevate the blood pressure. A priority assessment before the administration of the medication is to check the blood pressure. The physician should be notified if hypertension is present. Although options 1, 3, and May 4 be components of the postpartum assessment, option 2, blood pressure, is related specifically to the administration of this medication. 128. A nurse is preparing to administer Baractant, Cervanta, to a premature infant who has respiratory distress syndrome. The nurse plans to administer the medication by which of the following routes? 1. Intradermal. 2. Intratracheal. 3. Subcutaneous. 4. Intramuscular. The answer is 2. Intratracheal. Rationale: respiratory distress syndrome is a serious lung disorder caused by immaturity and the inability to produce surfactant, resulting in hypoxia and acidosis. It is common in premature infants and may be due to lung immaturity as a result of surfactant deficiency. The mainstay of treatment is the administration of exogenous surfactant, which is administered by the intratracheal route. Options 1, 3, and 4 are not routes of administration for this medication. 129. An opioid analgesic is administered to a client in labor. The nurse assigned to care for the client ensures that which medication is readily available if respiratory depression occurs. 1. Betamethasone. 2. Morphine sulfate. 3. Naloxone, Narcan. 4. Meperidine hydrochloride, Demerol. The answer is 3. Naloxone, Narcan. Rationale: opioid analgesics may be prescribed to relieve moderate to severe pain associated with labor. Opioid toxicity can occur and cause respiratory depression. Naloxone, Narcan, is a opioid antagonist which reverses the effects of opioids and is given for respiratory depression. Morphine sulfate and meperidine hydrochloride are opioid analgesics. Betamethasone is a corticosteroid administered to enhance fetal lung maturity. 130 RhoD, immune globulin, RhoGAM, is prescribed for a client after delivery and the nurse provides information to the client about the purpose of the medication. The nurse determines that the woman understands the purpose of the medication if the woman states that it will protect her next baby from which of the following? 1. Having Rh-positive blood. 2. Developing a rubella infection. 3. Developing physiological jaundice. 4. Being affected by Rh incompatibility. The answer is 4. Being affected by Rh incompatibility. Rationale: Rh incompatibility can occur when an Rh-negative mother becomes sensitized to the Rh antigen. Sensitization may develop when an Rh-negative woman becomes pregnant with a fetus who is Rh-positive. During pregnancy and at delivery, some of the fetus Rh-positive blood can enter the maternal circulation, causing the mother's immune system to form antibodies against Rh-positive blood. Administration of RhoD, immune globulin, RhoGAM, prevents the mother from developing antibodies against Rh-positive blood by providing passive antibody protection against the Rh antigen. 131. A 4-year-old child diagnosed with leukemia is hospitalized for chemotherapy. The child is fearful of the hospitalization. Which nursing intervention would be most appropriate to alleviate the child's fears? 1. Encourage the child's parents to stay with the child. 2. Encourage play with other children of the same age. 3. Advise the family to visit only during the scheduled visiting hours. 4. Provide a private room, allowing the child to bring the favorite toys from home. The answer is 1. Encourage the child's parents to stay with the child. Rationale: although the preschooler already may be spending some time away from parents at a day care center or preschool, illness adds a stressor that makes separation more difficult. The child may ask repeatedly when parents will be coming for a visit or may constantly want to call the parents. Options 3 and 4 increase stress related to separation anxiety. Option 2 is unrelated to the subject of the question and, in addition, may not be appropriate for a child who may be immunocompromised. 132. A 16-year-old is admitted to the hospital for acute appendicitis and an appendectomy is performed. Which nursing intervention is appropriate to facilitate normal growth and development postoperatively? 1. Encourage the child to rest and read. 2. Encourage the parents to room in with the child. 3. Allow the child to interact with others in his or her same age group. 4. Allow the family to bring in the child's favorite computer games. The answer is 3. Allow the child to interact with others in his or her same age group. Rationale: adolescents often are not sure whether they want their parents with them when they are hospitalized. Because of the importance of their peer group, separation from friends is a source of anxiety. Ideally, the members of the peer group will support their ill friend. Options 1, 2, and 4 isolate the child from the peer group. 133. A nurse prepares to administer digoxin, Lanoxin, to a 3-year-old child with a diagnosis of congestive heart failure and notes that the apical heart rate is 110 beats/min. Based on this finding, which nursing action is appropriate? 1. Hold the medication. 2. Notify the physician. 3. Administer the digoxin. 4. Recheck the apical rate in 15 minutes. The answer is 3. Administer the digoxin. Rationale: the normal apical heart rate for a 3-year-old is 80 to 120 beats/min. Because the apical rate is within the normal range, options 1, 2, and 4 are inappropriate and unnecessary. 134. Which of the following car safety devices should be used for a child who is 8 years old and is 4 feet tall? 1. Seat belt. 2. Booster seat. 3. Rear-facing convertible seat. 4. Front-facing convertible seat. The answer is 2. Booster seat. Rationale: children should remain in a booster seat until they are 8 to 12 years old and at least 4 feet, 9 inches tall. Infants should ride in a car in a semi-reclined, rear-facing position in an infant-only seat or a convertible seat until they weigh at least 20 pounds and are at least 1 year of age. The transition point for switching to the forward-facing position is defined by the manufacturer of the convertible car safety seat but is generally at a body weight of 9 kilograms, 20 pounds, and 1 year of age. 135. A nurse assesses the vital signs of a 12-month-old infant with a respiratory infection and notes that the respiratory rate is 35 breaths/min. Based on this finding, which action is appropriate? 1. Administer oxygen. 2. Notify the physician. 3. Document the findings. 4. Reassess the respiratory rate in 15 minutes. The answer is 3. Document the findings. Rationale: the normal respiratory rate in a 12-month-old infant is 20 to 40 breaths/min. The normal apical heart rate is 90 to 130 beats/min, and the average blood pressure is 90/56 mm of mercury. The nurse would document the findings. 136. A nurse is monitoring a 3-month-old infant for signs of increased intracranial pressure. On palpation of the fontanelles, the nurse notes that the anterior fontanelle is soft and flat. Based on this finding, which nursing action is appropriate? 1. Increase oral fluids. 2. Notify the physician. 3. Document the finding. 4. Elevate the head of the bed to 90 degrees. The answer is 3. Document the finding. Rationale: the anterior fontanelle is diamond-shaped and located on the top of the head. The fontanelle should be soft and flat in a normal infant, and it normally closes by 12 to 18 months of age. The nurse would document the finding because it is normal. There is no useful reason to increase oral fluids, notify the physician, or elevate the head of the bed to 90 degrees. 137. A nurse is evaluating the developmental level of a 2-year-old. Which of the following does the nurse expect to observe in this child? 1. Uses a fork to eat. 2. Uses a cup to drink. 3. Pours own milk into a cup. 4. Uses a knife for cutting food. The answer is 2. Uses a cup to drink. Rationale: by age 2 years, the child can use a cup and spoon correctly but with some spilling. By age 3 to 4, the child begins to use a fork. By the end of the preschool period, the child should be able to pour milk into a cup and begin to use a knife for cutting. 138. A mother of a 3-year-old asks a clinic nurse about appropriate and safe toys for the child. The nurse tells the mother that the most appropriate toy for a 3-year-old is which of the following? 1. A wagon. 2. A golf set. 3. A farm set. 4. A jack set with marbles. The answer is 1. A wagon. Rationale: toys for the toddler must be strong, safe, and too large to swallow or place in the ear or nose. Toddlers need supervision at all times. Push-pull toys, large balls, large crayons, large trucks, and dolls are some of the appropriate toys. A farm set, a golf set, and jacks with marbles may contain items that the child could swallow. 139. A nurse is preparing to care for a 5-year-old who has been placed in traction following a fracture of the femur. The nurse plans care, knowing that which of the following is the most appropriate activity for this child? 1. A radio. 2. A sports video. 3. Large picture books. 4. Crayons and a coloring book. The answer is 4. Crayons and a coloring book. Rationale: in the preschooler, play is simple and imaginative, and includes activities such as crayons and coloring books, puppets, felt, and magnetic boards, and Play-Doh. A radio or sports video are most appropriate for the adolescent. Large picture books are most appropriate for the infant. 140. A Spanish-speaking client arrives at the triage desk in the emergency department and states to the nurse, "No speak English, need interpreter." What is the best action for the nurse to take? 1. Have one of the client's family members interpret. 2. Have the Spanish-speaking triage receptionist interpret. 3. Page an interpreter from the hospital's interpreter services. 4. Obtain a Spanish-English dictionary and attempt to triage the client. The answer is 3. Page an interpreter from the hospital's interpreter services. Rationale: the best action is to have a professional hospital-based interpreter translate for the client. English-speaking family members may not appropriately understand what is asked of them and may paraphrase what the client is actually saying. Also, client confidentiality as well as accurate information may be compromised when a family member or a non-healthcare provider acts as interpreter.